Understanding your menstrual cycle is key to identifying your most fertile days. By learning how to track your cycle, you can maximize your chance of getting pregnant. So when we think about the menstrual cycle, there are two different parts of it. So the first part of the menstrual cycle is the follicular phase. Then your body gets ready to ovulate. And what happens there is your body sends a surge of hormone called luteinizing hormone, and that triggers your ovary to release the egg called ovulation. After that point, we are now in the luteal phase of the cycle, and that's where progesterone is produced. And that progesterone is a very important hormone for pregnancy. There are a lot of wonderful tools to track your menstrual cycle. One of the things that many of my patients use is a phone application or an app to kind of track when they're getting their periods, and those phone apps use a computer algorithm to predict when your fertile window is. Now, for people who have a very regular, predictable cycle, this is a great way to kind of track when is the best time to try to conceive. Some other options that you can use over the counter are things like ovulation predictor kits. Now, an ovulation predictor kit looks a little bit like a pregnancy test. You pee on it and it detects LH, or luteinizing hormone. Luteinizing hormone is what surges right before your body is getting ready to ovulate. So it is actually a predictor. It tells us your body is getting ready to ovulate, and it tells us that day and the next day are the best times to attempt to conceive. It's very important to time when you're having sex during your menstrual cycle, because there are certain points in the cycle where the chance of getting pregnant is extremely small, and there's other parts where it's very high. And so if you are able to track your cycles at home with one of the methods that we discussed, you can determine when is the best time to have intercourse. Usually the best time is going to be right around the time that you're ovulating. It's always better to err on the earlier side. So the egg only lives for about 12 to 24 hours, whereas sperm can be viable in the reproductive tract for 3 to 5 days. So if you're trying to time things, it's always better to be a little on the earlier side, because once your body has released the egg and ovulated, the chance for pregnancy is very small. So a normal menstrual cycle, if you look in a textbook, is anywhere between 21 and 35 days. But every person should have kind of their own set point. So I wouldn't expect you to fluctuate between 21 and 35 days. But a little bit of variation is very normal. Not everybody is perfectly on a schedule, but I would say most people are getting a period every month, and it's kind of falling within a relatively predictable time frame. If you do not have a regular, predictable period, that is really a sign that you should go see your OBGYN or a fertility specialist. Our period is really a vital sign. It's something that tells us about our health. And if you're not having a regular period, you want to see a physician who can do some testing and determine why your period is not regular, and then devise a course of action for that. Whether you're just starting to explore your options or you're seeking guidance on your next steps, our experienced care team is ready to support you. For more information, please visit your practice's website or connect directly with our team to schedule a consultation.